We're live. You can do the intro. Esther, we're live.
Okay, good day, everyone, and we're happy to have Dr. Gbemisola again. It's a beautiful Wednesday morning here in Nigeria, but we never can tell what it is. So, thank you for. We are grateful to have you again, Dr. Gbemisola. Thank you for always doing this with us.
Thank you so much. Good morning, everyone. I think it's a Thursday morning in Nigeria, all over the world. Welcome to ATP
Welcome
Hour.
to ATP Hour.
So you can ask
So you
any
can
question
ask
you may
any question you may.
about the health of your children in the next 1 hour, and we will try and do justice to them. So if you are watching on the Facebook, you can just drop your questions under the video. If you're watching on Instagram, you can drop your question and we will try and answer your question in the next 1 hour. Thank you so much for coming. Thank you so much, everyone, for joining us. I think you can share the video as well. I'll also try and do that from my hand here. I'm not sure whether people are already seeing the videos. I can see those on Instagram. Welcome, everyone. Welcome, welcome, welcome. Okay. So let's start dropping the questions and then we can answer them. And let's share the video. Okay, I'll try and share the video now. I'm not sure many people are saying it yet. We're sharing the video so that everybody can see it. Okay, so please ask your question. We just have 1 hour and then we can answer them as soon as possible. I can't see any question yet on Instagram. Okay. Okay, I think we have a question. Just give us 1 minute. I just want to make sure all the videos are pinned to the right places and then we can roll. Okay. So for those of us watching and listening, please share the video. Share, 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 share. Okay. All right. I guess we're done. Okay. So Hester, we have a question from Instagram. Don't see any yet on Facebook, but I'm sure people will join us very soon. The question we have on Instagram is from Mr. Zenires8. I say, good morning, Ma. Thank you for all you do, Ma. My 7-month-old baby can't roll from the back to the front and front to the back, but he can sit without supports. Should I be worried, Ma? The birth weight is 2.5 kilos 6 months. I can't remember the 6 month weight seems to have been cut off. All right, thank you, Mr. Zen Race 8 for your question. That's a very important question asking about the developmental milestones of our children. So you are worried because your baby is not able to roll, but then you say your baby is able to sit without support. Um, so rolling is actually between 5 to 6 months of age, and so I would expect that a baby that can sit without support should be able to roll from front to back and back to front. Then the question I want to ask is, how does that baby get into that sitting position? Because for a baby to be able to sit by themselves without support, they should be able to get into that posture. So if you are the one putting the baby into a sitting posture, and it is very unlikely that baby is already sitting completely without support. So because usually a baby who is sitting without support should be able to get themselves into that position. But notwithstanding, we will not be so worried about this age, because even when we say something averagely is 5 to 6 months or something like that, it is an average thing. Doesn't mean every baby has to do it at that time. So for me, I'm not going to be so worried about your baby at this 7 months who is already able to sit, even though you are worried the baby is not able to roll. So it's possible, number one, that the baby has not been given the opportunity, or you have not actually observed the baby do it. So you may want to pay more attention to that, because if a baby is able to sit with support, we assume, because there's something about development, they are always kind of incremental, So you, for example, a child must have neck control before the baby can sit with support, then they can roll, then they can sit without support. So they always follow each other. Though sometimes some babies can skip. The one they tend to skip is the crawling, and they may just go from sitting to standing and walking without crawling. But majority of babies will just follow them in that sequence. But having said that, we will not be so worried about your baby. If by the time your baby is 9 months and you're still worried that baby, because by that time we expect baby to be crawling, and that baby is not able to roll or get into that sitting position by themselves, then I will encourage you to see a pediatrician just to examine the child to make sure that there's no other developmental problem. But right now, I'm not going to be super worried, but I will say by the time your baby is 9 months, if this is still an issue, then you may want to see a pediatrician for further evaluation. Thank you. All right.
All right.
We still don't have any
We
questions
still don't
from
have any questions from
Facebook people.
Facebook people. No, not at all. Not yet.
So if you have any question, remember to ask your questions now, and then we will try and answer them. Actually, this week is our 7th anniversary on HCP, and so I really want to use this opportunity to wish all HCPians happy 7th anniversary. And we all know what we do. This is what we do as trying to support parents and families to raise healthy children. We don't want our children dying from preventable causes. And so one of the way we do it by this health education, health information, and providing that support. So remember that you can always ask your questions. You can always ask the pediatricians on programs such as this on Thursdays. On Mondays, we do the same. And of course, you can always ask from Monday to Saturday on our Facebook groups. You can post your questions there, and I'm sure one of our volunteers, professionals will be there to provide support to you and to your family. So thank you so much for joining us on this journey. So please ask your questions. We don't have any questions today, which is very unusual. I don't know whether you have any question, Esther, from your WhatsApp or any other platform. I'll also check whether we have
I'll also check
not
whether we have
on our group.
on our group. There's none here yet. None.
Okay.
Okay.
Okay, today's our day for
It's
now.
this our day for now.
No, no questions. I
Well,
hope the
questions. I hope the
I hope our questions will not start coming towards the end of the program. But for those on Facebook, remember that you have to go to the video itself, either on Fresh Waves Facebook page or the video on our own Ask the Pediatrician Facebook page. If you just drop it on the group, we may not be able to see the question. You have to put the question straight into the under the video. Maybe that's why it's not popping up in the studio. All right, I have another question from Instagram. Instagram people are on fire today. All right, Chief Girl is saying, "Good morning, Doc. My daughter is 4 months old and she can't reach for toys. Her head still dangles from side to side and she stuffs her hands stuff, or do you mean Stephen? I don't know. I'm not sure I get the part about stuffing a hand when being picked up. Okay, so this is another question again on developmental milestones. It's always good for parents to know what is normal milestones. Then we can always compare it to what is the if it is not going on call. So, if for those who want to know about developmental milestones, we have an article on our website www.axipediatricians.com where you can read what is normal, and we also tell you when you should seek help. So by 4 months, we expect a baby to have neck control. We expect the neck to be stable. I mean, that what we meant by neck control is that when you pick up a baby, when you pick up a newborn baby, the head may just fall to any side. And I guess that's what you meant by dangling. But by 3 months, most babies start achieving their control. So by 4 months, when you pick them up, their head should rise with the rest of the body and it should not be moving sideways. So if at 4 months your baby's neck is not yet stable, I will be concerned about that. And I think it's best to see a pediatrician because we really need to know why. We need to examine the child, number one, to confirm that the neck control is not yet there, or there's what we call head lag. After we've confirmed that, then we can now ask more questions, examine the child, and try to know why the baby has that, and then we can begin to talk about how do we manage the baby. So for a 4 month old who does not have neck control, I'm not sure I get the part about the hands, but usually babies their hands are fisted when they are born. They always close their hands, but by the time they're about 3 to 4 months, again, we expect them to open their hands, so their hands should become open and they should be begin to hold things. Reaching may not necessarily be that 4 months old, but at least they should be able to hold. So a 3 month old should be able to hold like a rattle, and we put something in their hand, they will just shake it. So that's what we expect. So their hand should be open, they should be able to pick up something and shake. Okay, so and of course, reaching for toys also has to do with vision. Can the child see? So if you're having many different areas of concern about a child's development, and I'm not sure whether you meant Stephen or stuff, I'm not sure I get the part. If the child's body is really stiff for any reason at that age, again, you need to see a pediatrician because we need to examine that child and we need to know what is going on. And the earlier the better. Let's not say, okay, I'll watch and watch. Sometimes it's better to see the doctors first. We'll do our evaluation and then we can advise you on what next to do. So, Chief Girl, I think it's best your baby should be seen by any of my colleagues, preferably a pediatrician or preferably a pediatric neurologist, developmental pediatrician, so that they can examine the child properly and then they can give you advice on what to do. So that's what I'm going to advise. All right. I hope that's helpful. But if you want to clarify anything, feel free to send additional updates about that question, and I'm happy to address it as well. Okay. All right. So I think that's all the questions I have right now on Instagram. And then I still don't have any question on Facebook as far as I can see. I hope those on Facebook, I can see some of you watching already, but I can't see any of your questions. So maybe you don't have any question. That's okay. But if you have questions, remember to drop your questions now so that we can take it in the next hour. I think we still have on the program. Okay, I'm just checking that people are not dropping questions under the video and we can see it. Okay, no, I can't see any. Okay, no, I can't see any. Oh, okay, we have one question on
We
Facebook.
have one question on this. Okay, thank you, Prudence Ngozi. She's saying, "Good morning, doctor. Please, when can a baby boy start sitting down?"
All right, thank you
All
so
right,
much
thank you.
for the question. Okay, I think today is about development. Maybe I should just talk about developmental milestones. So, sitting down is the same whether for boys or for girls. I always get the impression, based on question people ask, that we think the timing should be different for boys or girls. I think there are lots of myths about boys and the back and the fact that boys should not be made to sit early or something because they are, I don't know whether what, I can't remember what they think the myth is saying about what will happen if that should happen. But the honest truth is the fact that developmental milestones is the same for boys and for girls. And so usually most babies will start to sit with support, whether they are male or female, boys or girls, they will start sitting by 5 to 6 months. That is the average time for sitting with support. When we say sitting with support, we mean you can put something at the back of the baby, and the baby can sit up, but they need something to support their back. And by 7 to 8 months, the baby should be able to sit by themselves without any support at the back, and the spine will be very straight. So that's what we meant by sitting without support. Now, we don't need to train babies to sit, we don't need to force them into sitting position, because that's another follow-on question to that, like, okay, when do you start sitting the baby? And I see people on Facebook posting videos of trying to put the baby in a sitting position, and you see the baby head almost touching the floor of their chest. And and some mom will say, "Well, that mean my baby is sitting." Your baby is not sitting yet. Okay, when your baby is sitting, they will be straight. So from the beginning part, 5 to 6 months, you need something on their back, or else they will, after a while, they kind of slouch and then fall off. But if you support their back, then you can sit. But we also don't expect you to leave them sitting for too long anyway. So, but by the time they're sitting without support, they can sit with their back straight, and you don't have to put anything behind them. So when children are ready to sit, they themselves begin to go into that sitting position. Number one, they must have achieved their neck control, so their neck is straight, and I mean not falling backwards. Then the next thing will be for them to be able to sit with something. They will, when you carry them, you see that they tend to go into sitting position. Before, when you carry babies, they tend to lie flat on your hands, or if you put them on the bed, they tend to lie flat. But when they want to start sitting, you start seeing them going into that, more upright posture, and then you can, that okay, this child is ready, and you can support their back. So it has nothing to do with gender per se. So it's still the same for both the boys and the girls. I hope that is helpful, Prudence. But we will say averagely for both the boys and the girls. So we'll say averagely 5 to 6 months.
Okay, thank you very much, Ma. And from Maria Shirozum saying thank you for everything you do. Yeah, thank you so much, Ma. Thank you to the foundation, and also thank you to every listener and the people that ask questions too. Thank you so much.
All All right. We have a question on Instagram from Adupe Baby. Say, good morning, Doc. I noticed my 2 months old baby is creeping. Okay. Gradually, my mom says la in Yoruba language, but I don't know what to apply. Okay. So this is a very common question, and this is a very common observation when babies are born, and they sometimes lose their hair, and the way they lose their hair may be different, and some have their hair, they will have like some part of the hair being cut off and it will form shape. I remember people in ATP were calling it free baba, and that's my first time of hearing such, and all that. So there are many reasons why baby can lose their hair. Okay, number one, babies, as part of the natural hair cycle, when we say a cycle, in other words, the natural way things are done, it's normal for baby actually to lose their hair sometimes, and then it will grow back again. And for those kind of babies, those are the ones that they tend to lose their hair in all those funny style, maybe at the what we call the occiput, the back of the head, and all that, or some will just lose it on the side and all that. And but what you will notice in those situations is that there will be no rash or anything under the scalp. You will see that there's nothing like a area that looks different, that the color is different, or like some flakes or dandruff stuff, or like ringworm kind of a picture. You won't see anything on the scalp. The head, the scalp, the scalp is the skin that covers the um I mean, I'm sure we all know what the scalp is. That's the skin that covers our skull. Okay, you will see that it looks normal. There's nothing there. So that means that it's not because of an infection or anything that is making the baby to lose their hair. But baby can also lose their hair for other reasons, like cradle cap. Cradle cap is the one where there's like dandruff. It will be coming. When you comb the hair, you see this whitish stuff or this yellowish stuff, and or like sometimes it can look a little bit black as well. You see as if it is peeling off of the scalp, and it comes out with the hair. So that's one way baby can lose their hair. So uh another reason why people maybe lose their hair is if they have what we call fungal infection, like most people will call it ringworm, but it is not only the ring type. The ring type, we will call it the tinea capitis. That is one type, but we also have other form of fungal infection that can affect the hair, the scalp, and when as part of it, the baby can lose their hair. We also have some other rarer conditions. We call the alopecia areata, that they are just like genetic condition, which we don't which can happen to some people and all that. So different causes of hair losses in children. And the most important thing is to know which one are we dealing with. Okay. So I would say, for example, if you couldn't see anything under the head, like on the scalp looks normal and fine, then it is those kind of hairstyle that tends to happen on the occiput area and all that, and the rest of the hair is growing well and nice. It may be part of what we call the natural hair loss of babies. The good news about those ones is that it will grow back. So it's more of a cosmetic picture. It's just like the way it looks, and some parents don't like that. So I always tell them, if you don't like it, you can cut the whole hair off and then wait for the hair to grow back again, and it should grow back normal. Okay, but if you see anything else on the scalp, like a wound or like flakes, like dandruff, or it's not looking, healthy like normal, then that means there may be something else going on, and then we need to, those are the ones that we need to treat. Okay, or like maybe you see that area looks brighter, like lighter than the rest of the skin. Maybe your baby's dark skin, and that particular part of the scalp is looking as if it is whitish or yellowish. So that tells you those ones may be a sign of fungal infection, or if you are seeing flakes and all that. So if you have those ones, those are the ones that we will call fungal infection. Yoruba people use the word ela a lot for almost virtually all skin diseases. So some people use for fungal infection. So it is not like a very specific word for a particular in a medical equivalent. They use it to cover a lot of rashes or a lot of different color looking kind of a rash. But in medicine, they may not all be the same. So we prefer to say it, and then we can now advise you. I actually tell parents, don't just go rush to use any products. People will just see a rash on baby skin, and then they are just telling you go and use A or B. And some others, even when they ask questions, they will come with the I've used A or B, and they will be surprised that because they've used A or B cream, the rash has not gone, as if A or B cream is like a almighty solution to any kind of skin rash the baby may have, whether on the scalp, on the skin. There's actually no almighty one case fits all solution to all rashes. So we need to know which one it is we're dealing with. That's the difference between medical people and our neighbors and our experienced mothers. We just tell you everything is this, and then no, different things may look alike, but they may not be the same. And then the approach, the treatment will be different depending on the cause of that particular rash or cause of the hair loss. So that will now determine our approach. So what I'm going to advise you to do, Adope Baby, because I'm not sure which one. I'm sure you are thinking through all the options I've mentioned, and you're thinking which one your baby has. So if there's anything on that scalp at all, then you have to see one of my colleagues in the hospital so that they can recommend appropriate treatment for you. I hope that's helpful. Thank you. All right. I think we have another question on Facebook. Great. All right. I think we have another question on Facebook.
Yeah, from Facebook. Thank you so much, Prudence again. Doctor, someone said rubbing shea butter on baby's penis will make him not to function well later in life. How true is this?
Hmm. Hmm. Thank you so much, Prudence. I think you are living in a place where you hear lots of myths, and I think I've done a whole series on myths. I talk about myths in different areas, and I think you will benefit from listening to them. It's on our it's on this Facebook pages, and it's also on my podcast, Ask Dr. Gbemi ATP. So this is a myth, okay? It's a myth, all right? Myths are popular beliefs, but they are wrong, okay? So shea butter does not affect a boy's sexuality or fertility or the penis in any way at all, okay? So a child's ability to function, to mature, to reproduce, which happens what during puberty, it has to come from the brain, okay, and it goes down to the testes, all right. So it has nothing to do with the penis, which is just a conduit for either the urine or the sperm. So it has nothing at all. So what you apply on the penis or not does not even have anything whatsoever to do with fertility or reproduction. Now, what really affects boys' fertility issue which many parents don't take note of, which I think, since you've asked this question, I'm just going to use this opportunity to chip that in, is the testes being present in the scrotum. Okay, when babies are born, as mothers, as parents, it is important for us to check that their balls, their testes, the two of them, they are present in the scrotum. I've seen a lot of parents asking me when their boy is already 11 years old or 10 years old, and they're asking, oh, they can't feel the balls, and they are just like, what can they do now? It is too late, all right? So usually when babies are born, it is important that the doctors examine them, right? This is the reason why you should deliver your baby in the hospital. Even if you deliver at home by a midwife or in a other setting, please, it's important that your baby should be examined. There's what we call baby check, okay? I know some of us just go to hospital, just deliver, you want to go home quickly, quickly, and no doctor has seen your baby. It is wrong. It is important that a baby is checked. And those are the things we are looking out for, okay? We're counting their fingers, we're counting their toes, all right? But we're also checking the hearts, making sure there's no heart disease or murmurs. We also need to check that the scrotum, as the two balls, or what we call testes, they are present. So we hold one and look for the other and make sure the two of them are there. So if the two of them are not there, we need to look for where they are. Sometimes they are still coming down. So if we can feel them on their way down, what we call the inguinal area, they are still coming down into the scrotum, we will give them, because when baby is being formed in the womb, the testes are actually formed in the abdomen, but they now move down because they cannot stay in a very hot area. So they have to move down to the scrotum, which is the cooler area. That is why the scrotum is outside the body, because the temperature of the inside of the body will damage the sperm production apparatus. So they have to move out, and that is it. So it's important for you to always check that the two testes are present in the scrotum. If they are not, they must be looked for, and they must be brought down within the first year of life. So usually the doctors, if you can't find them, we do ultrasound scan, we locate where they are. Sometimes we give them time to come down, especially if they're already on their way down. But if by the age of 1 year they are not down, they have to do an operation to bring them down. We bring an operation to bring them down and fix them down. So that is more important rather than worrying about shea butter application on the penis. That is number one. The second one is the stream of the urine. So when boys pass urine, it's important to check that it is a straight stream. So when boys are passing urine, it should go straight. It should be straight, and usually it's very easy, because most of you mothers, when you want to change diaper for your boys, then they pass urine and the urine is reaching it's coming to your face. So I know you're upset about that, but that is a good thing for us pediatrician, because that says that boy's urine stream is straight. Okay, so if your baby is dripping urine and you never see it go straight, you must see a pediatrician. If it is not going straight and it's dripping, or it's going sideways or anything like that, it may be a sign there's a problem with the urinary tracts area, what we call, there may be something like posterior urethral valve, there's something wrong with the pathway for urine coming out. And sometimes we need to fix that early enough, because if we don't fix it, it can cause damage to the kidneys. So those are the important things, especially when it comes to boys. Those are the two things we should check out for. The testes, both of them should be present in the scrotum. Secondly, the urinary stream must be straight. If any of those ones are not present, you need to see a pediatrician, and we need to fix it. But whether you apply cream or shea butter, no, it doesn't affect your baby's fertility. The same thing with soya. People also believe that if your boys eat soya, then they are going to be infertile or not. That again, that is another myth that has absolutely no truth at all. So I hope that's helpful, Prudence. All right. I think I have a question on Instagram. I'll just go. Okay, I think Chifegal is asking me. Chifegal was one that asked about our baby snare control. Doc, with your experience and qualification, is there any tips you can give to parents whose babies are having developmental delay? Okay, to help them reach their milestones, like things to do and not to do. Okay, thank you. That's a very beautiful question, Chifego. And I think you're asking the right person because that's my specialty. I'm a neurodevelopmental pediatrician. So it is my job to see children who have developmental delays, whether and other uh, disability, whether physical, mental, and all that. That's just my job description. Number one thing is if a child has developmental delay, we must know first. Okay, sometimes people think there's developmental delay, there is really none. Sometimes parents compare their children unnecessarily to other children, and so I've seen somebody who is worried that a 6 month old baby is not crawling, and I'm like, no, I mean, 6 month old crawling, no. A 6 month old should be sitting, that's all I want, not crawling. So the first thing is to know what is normal milestones, and then we can compare it to what is abnormal. And then remember that when we say something is average, so we say baby should walk averagely at 1 year, we pediatricians or developmental pediatricians, we give some babies, extra time because we're all not the same. So some babies are going to get there, but they're just a little bit slower than normal. But it doesn't matter, it's still normal. So everything is a range, everything is average. So we will not worry about walking until your baby is 18 months old, even though most babies walk at 1 year. But we still give those who we call late bloomers or whatever, we give them time to catch up. So if by 18 months now, so we give them like extra 6 months to catch up. If they've not caught up, then that is when we will begin to worry, or we begin to ask, what is there's something definitely wrong here? Then what is it? Now, the most important thing is to know a diagnosis, to know what is actually wrong. I find out that many parents, we don't know what is wrong, number one. Number two, we put our own spin on the possibility of the cause of the problem. So we live in a very spiritual, conscious kind of environment. So people are always thinking everything is witchcraft, everything is attack, everything is not demonic attack. Okay, we need to be conscious of that. And so some children being developmental delayed has to do with their brain. Okay, now that's another thing to know. A lot of parents also think, oh, maybe it's the muscle, maybe it's the lack of calcium, and we begin to use the medicine for leprosy. We use the medicine for headaches to treat leprosy. I'm trying to paraphrase a proverb in Yoruba, but basically we are not approaching it the right way. So the first thing is check your child milestones, know what is normal. If you are worried about it, please see a pediatrician. Let's know what is wrong first, and then we can now talk about solution, because if we don't know what is wrong, we will not be able to fix it. Okay, we need to know. And sometimes, unfortunately, some of our hospitals, some cases are not every doctor's case. Okay, some of you go to places where they will just tell you there's nothing wrong, or just be patient and all that, and we lose time. And in children, when it comes to developmental issue, early intervention is very important. So early intervention works. So we really need to diagnose it early, and we need to start fixing it early. No, so that is the first. So for parents, I always want you to get the right support. Please see a pediatrician. If you're not sure where to see one, go to a teaching hospital. I'm very sure that the professionals you're going to see in the teaching hospital, they are most likely the right professionals. And I'm talking to those in Nigeria now, other parts of the world, I'm sure you know where to see your professionals. And they are likely going to tell you the truth. They are not likely going to give you false reassurance. That is number one. Then number two is, now once you know what is wrong and you know what is likely going to happen in terms of what we call the management and the prognosis, then you now know that you are your child's number one therapist. So most children who have developmental delay will need some form of therapy. So for example, if it is physical, we talk about physiotherapy. If it is to do with their hands, we talk about occupational therapists. If it's to do with their speech, we talk about speech therapists. Most of them don't need medications. Most of them, actually, except they're having convulsions and all that. So the brain is one peculiar organ. I always think the brain is the most important organ in the body. People think it's the heart. Some people think it's the kidney. I think the brain is the most important organ in the body, because every other thing respond to the brain. Okay, but now the brain is unique in the sense that most of the other organs, like your skin, if you have a cut, is going to heal, and that is it. But the brain is one organ that does not heal by itself. It doesn't grow back. So if a part of the brain is damaged or injured, that part of that brain is gone and it's gone forever. It's not going to grow back again. Okay. So the good thing about knowing that is that we try, if a child already suffered brain injury, we want to make sure that we protect the rest of the brain so that it does the damage does not happen to the rest of the brain. That's just number one. It also helps us to know that what to expect. Okay, so for example, if a child has cerebral palsy, a part of the brain is damaged. Sometimes you can't recover back what has been lost. Okay, sometimes what we need to do is to provide support around what we can do. The reason why I'm saying this is that sometimes people are always looking for, parents want cure, they want also give you a magical drug and everything will go back to normal. And one of the things I normally do when I see my patients when they have children with developmental is to have this conversation. I can spend an hour just talking to you. We are not even going to do anything because I really want you to understand what is going on. I really want you to understand where the problem is, what we're seeing is happening. Sometimes we don't know why, but most time we do. And then I always want you to understand what we can do. So we give you hope, but we also being realistic with our hope. So we let you know that. So for example, I'm not going to tell you, I'm not going to promise you any cure. I'm not going to promise you any drug that is going to fix everything. There is none. That is the honest truth. And then but we can work with what we have. So with therapy, with training, with modification, with this, with that, the child can still accomplish their full potentials. Then everything sometimes they are different. So some children have mild issues, some children have moderate, some children have severe. So depending on where your child is, I know acceptance is quite difficult, but it's helpful for parents to know that, okay, my child has a severe condition and this is how I can help my child. So that I find parents sometimes spending so much money looking for the cure, and the one that we know can work, they abandon the therapies, but they're looking for the solution that cannot work, or somebody promised them that, because we pediatricians tend to be realistic. We try to tell you that, but some people will tell you they promise you heaven and heart and they charge so much money, and people always fall for that because they are looking for the solution, they're looking for the cure. And I mean, we are not God. We know God can do miracles, but we are not God. So we try to say what we can do. So I always want parents to understand that. I want you to research about the condition, understand the condition, and know that, then know what you can do. Okay, I can help my child with physiotherapy. So when the therapy does 1 hour with my child, the child is with me for 23 hours of the rest of the day. I can do more of those therapies at home with the child. So those are the things you can do. So you do more of what you can do. You also join support group. I find that when parents see other parents who are walking that same journey with them, then it's lighter. It's because, if, for example, if your child has an autism diagnosis, for example, maybe your child is getting diagnosed at the age of 2 years, and you see a mother who has a 35-year-old, I mean, who has gone through that journey for over 30 years, and they tell you this is how it was, and no, you feel like, okay, yes, at least I'm not the only one, and somebody has gone through it. If they've gone through it and they're standing and their children are doing well now, I can go through it. So support group also helps parents. I find that parents sometimes think pediatricians don't understand, we don't feel them. But when they talk to other parents who have actually walked in their shoes, it helps them better. And we really, really love that and really support that. So those are the things you can do as parents. Number one, you need to really get, I know sometimes it's hard. Parents go through period of grief and all that, and deniers and all that. But after a while, we need to get to the point of acceptance, and we need to get to the point where we know that, okay, what can I do? Then we can now start talking. This is what you can do as a parent and support your child. And I just want to encourage you to know that it's not the end of the world, even if a child has a developmental delay or diagnosis. People with, we call them differently abled, some people call it disabled, they can also do a lot. They can achieve a lot as well. And I'm sure you see a lot of people who are differently abled who are doing something. So I like to look at those people to motivate. Of course, not everybody is going to be like them, but it helps you to know that even disability can be can may not necessarily be the end of the world for a child, and you can just support your child from where you're from your home pattern. You are your child best therapy, support, everything, because you are doing it from the point of love, unlike the professionals who are just doing it for their own um, salary and all that. So I think that's all I'm just going to say. That sorry I went a little bit overboard, but because I think it's a conversation we really need to have. Maybe we'll come back and have it another day. All right, Chief Egal, I hope that is helpful. If you want more, please ask. Thank you. All right, I think our questions have
All
dropped
right, I
now.
think our questions have dropped.
Okay, thank you very much, ma. So from Gabriela Umenina, good morning, doctor. My daughter of 4 years has mumps. How will I treat the pain?
Okay. Thank you, Gabriela, for your question. For mumps is a viral infection. It's caused by virus called mumps virus. So the good thing about viruses or viral infections that they don't have any specific drugs for their treatment. They always come and go. They run their course and that's it. So, but what we do is what we call symptomatic treatment. So we treat whatever symptoms the child is having. So the child is having fever, we give something to relieve the fever. The child is having pain, we give them painkillers. So if your child is having pain, give paracetamol. That's all we're going to give. You can give the paracetamol, and when you give paracetamol, you can give it every 6 hours for maybe 2, 3 days, or at least until the pain is gone. So that is what you need to do. Just let the child drink a lot of water, give paracetamol. You can also use ibuprofen. Those are the things you can give your child for mumps, okay? And sometimes I'm very cautious about parents making the diagnosis. I hope you're correct with the mumps. So because it's not every swelling that is mumps. So usually mumps should last about max 2 weeks, 14 days, and it should go away. So if that swelling is not going in 2 weeks, or there are other issues, please don't assume mumps. Better get a pediatrician or a doctor to at least have a look. But if it's just mumps, you don't need to worry. It's going to run its course. Paracetamol, lots of water. Keep the child at home because it's contagious, so that they don't spread it to other children at school and it will go away. I hope you all know that mumps is preventable. We have the mumps vaccine. The mumps vaccine is part of the MMR. So that MMR vaccine is measles, mumps, and rubella vaccine. The three of them together in one vaccine is what we call MMR. So if you don't want your children to have mumps, get them the MMR vaccine, and that will take care of it.
Okay, thank you, ma. Another question. Does leaving baby hair alone without cutting it has any effect on the child? This is coming from
Okay. Thank you, Bodude Habosede, for that question. No, it doesn't have any effects. No, it doesn't have any effect. We get a lot of questions about hair, hairdo, and all that, and I'm always like, that is not for the pediatricians to answer. But I guess we answer everything about children issues, so it's fine. So it doesn't have any effect on the baby. So some people don't cut their baby's hair and they leave it for long. Some people cut it from the 8th. I think our Muslim faithfuls, they will cut their baby's hair from the 8th. Some people don't cut their baby's hair at all. Some people have cultural beliefs about that people that their hair must not be cut until they are 1 year old or things like that, and you have to kill cow and all that. All right, all those ones are myths. But it's up to you, really. If you, it is for me, it's about how you can manage the hair. So as long as you're able to comb the hair and you can manage it, you don't have to cut your baby's hair. It's not it doesn't have any medical or health issues whatsoever. But I didn't cut my last baby's hair until he was 1 year old. He has this plenty afro hair and I love it. But after a while, to comb and to manage it was becoming so difficult. So immediately after first birthday, I have to just go and cut it. So you can leave your baby's hair, but you must know the stress of dealing with especially for those who are African, our hair can be very tough. So if you are struggling with combing the baby's head, baby is crying, another beg, please go and cut it. For the girls, it's easier because you can easily, put it in pubs and all, you can do different hairstyle for them, lovely. So, but the boys are the ones that get parents struggle with the comb and all that. But it doesn't have any else implication whatsoever. Thank you.
Okay, she's also asking another question about what age does a baby head fully form from Bodide Abosede, still same person.
Okay, but today I'm not really sure I get that part of the question. What do you mean by the head is fully formed? So when you say the head, there are different parts of the head. So we have the brain. For us, that is the most important part. So I don't know whether it's the brain you are asking, because I mentioned something about the brain not being fully formed at birth. And then of course we have this skull, that is the bone. And then we have the scalp that covers it. Those are the things that make up the at least the part of the head before the face. All right. So if it is the brain you are asking about, the brain of the baby, 95% of it is developed by the age of 5 years. 95% of brain development happens in the first 5 years of life. And of course, it keeps growing little by little, because that is why you can learn skills. Your brain is adjusting and changing. That's why you can learn new languages. That's why you can learn skills and all that. So, but 95% of all that development of brain happens in the first 5 years of life. And that is why if your baby is living in a place where they speak 3 or 4 languages, the child can learn all of them at the same time, because their brain is developing, is plastic, is it's what we call synapses. Is they are forming them so rapidly. That's why it's easier for children to learn languages than for adults, because their brain is still maturing and growing. Unlike adults, our brains are almost fully formed. So learning a new skills is always so much more difficult for us, but we can. The brain is still developing, but it's the bone of the head, they are not fully, they are separated. We have what we call sutures. So the idea of that is that, so that as the brain is growing, it allows the head to grow bigger. So like I said, 95% of that will happen by the age of 5 years. So then they begin to fuse. So all those spaces between the skull, they begin to fuse together. So, but the head will still be growing, but very, very tiny and all that. So the first 5 years of life is the most crucial period. Any injury to the brain at that part, at that time, is disastrous, because that is it. There's nothing we can do about it. So the growing brain is very delicate. We must protect it, because any injury to it cannot be reversed. All right. I hope that's helpful about today. All right. The next question. Next question.
Okay. Still from Bodide Abosede say that how does one handle a toddler that like shouting at the slightest touch or when beaten?
Okay, I really I would love to know the age of the child, number one. And then I'm not really sure I get, is it the child crying in protest against you threatening to beat them? Because you said slightest touch or beating. So I'm not sure this your touch is a loving touch, like a cuddle, because I really need to get that part very well so I know what to advise you. All right, number one, we don't want to. Beating children. I know it's hard because for parents, because we believe that beating children is the right way to do, because that's how our parents, some of us, brought us up as well. In some countries, like in Wales, it is illegal for you to beat a child. I know Africa, we believe it is normal thing, but we should try and focus on discipline our children. Discipline and training different, rather than eating children all the time. Sometimes we eat children, the children don't even know why we're eating them. They don't even understand. And making a child uncomfortable and making them cry and all that is not going to make them do better. It's just going to, that maybe that's why the child is going to protest child, because you are eating them. So there are other alternative measures that we can use to discipline children. Our timeouts, taking privileges away from them and all that and all that. So, but even if I thought you're going to beat them, let them understand why you're doing it and don't do it in anger. And we really we don't advocate that as pediatricians. We don't advocate, but people sometimes injure their children all in the process of trying to correct them or beat them. So we really, really don't advocate what we call capital punishment. Um, I know some people argue it's a controversial issue, it's a contentious issue, so I'm not going to go into all that. But whatever you do, I really want, but if you are still on the program, I really want to understand, is it when you want to be the child that the child is shouting? Because that is normal, because everybody doesn't like to be beaten. I think I will shout as well. But if there's other issue about when maybe the child shouting, even when being corrected and all that, maybe you need to put more clarity on that question so that I'm sure, and then I can address it. But if it's about beating, I don't think there's anything wrong with a child protesting when you want to beat them, especially a toddler. And then number two is that the age to beat people, we also need to understand child development. I see a lot of people beating 1 year old, and a 1 year old does not even understand that. They don't. So we need to understand how our child development is. I know we need to understand when children begin to understand consequences and all that. So a 1 year old does not understand consequence. So if a 1 year old is doing something you don't want them to do, what you need to do is to remove them from that situation. That's all. Remove them from that and take them somewhere else and distract them. If you beat them, they don't understand it. So that is how their brain is at that point. Their brain does not process consequences like, okay, I do this, I get this. So that is why you tell your child, the fire is the lantern is hot, don't touch it. They'll still go and touch it because they just want to they want to try it, because they don't understand that consequences at that point in time. But usually by the time they're about 3 to 4 years, they begin to understand that if you do something, this is a consequence and all that. So that is when you can begin to use that method. Okay, that is when consequences now happen. And natural consequences sometimes is better. And of course, or you can already have that conversation. It's better to teach the child first, this is what I expect from you, and if I don't get it, then this is what you get. You already have that conversation before you now start just the punishment, the eating and all that. Then children get up resentful, they don't understand why their parents are beating them, and then the children go to school and eat other children, and then we wonder why did they learn that from the parents. So those are the things that we really need to understand. I think maybe one day I'm just going to talk about parenting from the pediatrician's perspective. I know we've had other program about parenting from other experts, but I think we need to understand the biology and some of our children's brain work, or how they develop, so that when we're doing things, then we know how to approach it in properly. I think that's another topic for another day. All right. I think I have a lot of questions now on Instagram. Let me just check. Oh, okay. I think I've answered them. Yeah, we've answered the question on Instagram. Just checking. No, we've answered them. Okay, I think our time is up anyway. We just have 2 more minutes left. We just have 2 more minutes left.
Okay,
Okay.
thank you very much. It
Okay.
has been an amazing time. Thank you for always doing this with us. We're always glad to have you. Thank you.
Yes. Thank you so much, Esther, for having me. So thank you so much, everyone who has joined us. I know some of you are just aware of the program late, no problem. But if you still have any questions about the health of your children, please, you are free to post your questions on our Ask the Pediatricians Facebook group from Mondays to Saturday, and we will answer them. And if you want us to talk about any particular topic, I think one of the topics I'm going to talk about is children with special needs, and I'm still going to talk about parenting. I think those are the topics that is coming across to me from the questions I've answered today. So I'm happy to do that in subsequent episodes, and once in a while, at least once in a month or twice a month, we'll come back and we do a live show. I think we'll try and give you enough notice about our live show so that you can get your questions ready and then we can answer them. All right. I think Bolude is giving us more clarity. We'll take that last question and then we wrap it up with the bed.
Wrap it up. Okay, man. She's saying that age 2 going to 3 and will always crying whenever he wants to do something and she's not able to do it. And even when playing with friends, maybe when they are playing together, she'll be the one to start the fight. But when they now beat her, she would start crying. Now begging her, she will still start the volume of the crying. I can relate to that.
Okay.
Okay.
All right.
All right.
That's what we call tantrum. So a 2-year-old we have tantrums. So that's why people call them terrible twos, but I like to call them terrific twos. Again, I think that's exactly what I was trying to say. You need to know what is expected at different ages. So at age of 2, they are trying to assert their individuality. They are trying to assert their autonomy. They are trying to, for once, they realize that I am actually a independent human being, and I don't need to. I can do things by myself. I can also make some trouble here and there. So it is normal for age 2 for them to have a lot of these tantrums. But I just worry about a little bit in your question, like if when your child is frustrated, he kind of cries, like he wants to do something and she's not able to do it. Yes, so she will cry. Sometimes that is frustration, and that is the child expressing. So that's a teaching opportunity for you to tell the child, okay, yes, if you can't do something, ask for help, then you'll be there to provide the help to the child. If the child has any other developmental issue, like the child is not talking, like the child has other repetitive behavior, I would say see a pediatrician, see one of us. But if the child is otherwise developmentally okay, then that is just tantrum and frustration and all that. And yes, sometimes some children, when they are crying, you just leave them alone. You don't have to try to quickly get them to shut up, which is what you are trying to do. Just give them their break. Sometimes it's okay to express your emotion. Let them get used to expressing their emotion and let them give them time to cool off. Then they can always come back and all that. Okay, I think both of them, if you have more questions, you can always send it to us on Ask the Pediatrician, then we can address that. Otherwise, I hope I've been able to address the question. Thank you so much, everyone, for joining us this morning, and we'll hope to see you next week, Thursday, for another episode of Ask the Pediatricians Hour. It's bye from me.
Bye from me. Yeah, thank you. Bye, everyone. And you can always listen to us on Fresh Rays Radio. We are live 24 hours and 7 days. And Ask the Pediatrician is always live, the same time on the same station. Thank you always. And thank you also, Dr. Gbemisola.
Thank you.
Thank
Bye.
you. Bye. Bye.